It is time for another edition of First Alarm Family First. I'm Jen Herrera alongside Carolyn Acosta. We are both in South Florida, but our guest today, Grace Seide, is up there in Washington, D.C. And Carolyn, we are so happy to have Grace with us today.
Yes, today we're excited to have Grace Seide, a clinician from the International Association of Firefighters, also known as the IAFF. That's the union that represents professional firefighters and paramedics across the United States and Canada. So we're really excited to talk to her about what they offer there, what she does, what her role is there, and learn more about the facilities. Grace, welcome.
Hi, thank you for having me.
Can you tell us a little bit about your background and how did you first get started into the mental health field?
Yeah, for sure. So I've always been interested in psychology, and going through college, I was just telling her I love the military and first responder population. So I ended up finding this facility randomly. I was trying to reach out to any therapist that worked with the population, and one person in Seattle said that they heard about the facility. So I ended up applying and got up there August of 2020. What was 4 years ago? 2021. Going up there, I started from the bottom at the facility and worked my way up. I started my master's in military and first responder psychology. And so I was a BHT when I first started, and then I was an intern, and now I'm a clinician there.
I want to talk about a really important part of your story because as a girl who was born in Hialeah, we know that your dad has worked for Hialeah Fire Department for
Yes.
20 plus years. You talked about your affinity for veterans and for first responders. Growing up with a dad who's a firefighter, did that play into it?
Absolutely. Yeah. I mean, I remember take your kid to work day. I always went to the fire station. I saw kind of the camaraderie that they had and, the energy that the fire station has. And I loved it. It definitely had a huge factor in me going into the field I'm in.
That's amazing. So how did your journey lead you to the International Association for Firefighters?
So as far as how I got to that facility, so it was really just reaching out and networking and finding that it existed, first of all, because it's the only facility in the country that is strictly firefighters and it's inpatient. But it was really just networking and then working my way up to a therapist.
As someone who was also raised by a firefighter, I don't ever remember being scared when my dad went to work. I don't know why. I don't know if it's a hero complex, right? That we see our fathers in that light. I don't know if it's because they, present themselves that way, that they're not afraid of anything. Now, as the wife of a firefighter and as an adult, obviously, I realize how much, and from doing this with Carolyn, I realize how much really does come with the profession. I'm curious, as another firefighter child, do you ever remember being scared? Because I have those fun moments too, right? The career days and going to work with them.
Mm-hmm.
And, probably shouldn't say this, but getting to ride around in the trucks. I mean, they let us do that. So there's all this positive stuff. I don't ever remember being scared. Do you ever remember being scared?
No, he's definitely always been someone who's stable and, present and definitely has that energy that you're talking about 100%.
It's wild though, right? Not completely clueless as to what their day-to-day actually was.
Yeah, absolutely. I mean, I remember when I got a little bit older, he'd tell me a little bit more in depth what kind of calls he went on and how things went. And it definitely was my dad does this. That's crazy. Yeah. I mean, I even remember one time we were at dinner and somebody started having some sort of medical issue and he got up and I was like, what are you doing? Sit down.
Do this?
This can't be happening. So it's definitely weird having that different perspective that I didn't have before.
Yeah.
Yeah. So what does your day, let's say, look like, being at the facility over there?
Yeah, so there's a couple different areas that we do. So we have group therapy. So 5 hours a day is group therapy. So different topics, psychoeducation topics. So it could be on anything resiliency involved. So moral compass and social support and all that stuff. And then we can have topics that are anxiety, depression. We have a suicide one. So they are getting a full range of education and support in the group setting, which can be great because you have your peers around you to kind of help you through it. And they understand they're all firefighters from all across the country. And then I also have individual sessions. So every clinician has about 4 to 7 on their caseload. So in addition to teaching those groups, I have my own people that I see weekly. We also have family therapy. I don't do the family therapy side, but we do have that available. And what else do I do? I also teach, I also do the trauma groups. So not only do we have the group therapy that's more generalized, but we have trauma groups specifically. So we do CPT therapy, which is the trauma therapy. And there's about 4 to 5 people in there at any given time, and we're going through their specific traumas.
And what
Is
is
there
exactly CPT? I'm sorry.
CPT is cognitive processing therapy. Sorry. There's a lot of acronyms.
Yeah.
What does that mean, cognitive processing therapy?
So, cognitive processing therapy is I'll break it all down. The main thing that we use is CBT therapy, which is cognitive behavioral therapy. And that's the entire theory that your thoughts influence your behaviors. So if I walked around thinking that I wasn't a good person, I'm probably not going to try to be friends with that person or go for that job because I have this belief about myself. So targeting those beliefs and changing them, so me starting to think that I am a good person and I'm trying my best, is going to change my behavior to then I am going to apply for that job and I am going to try to be friends with that person because now this is my new belief. So it's really catching those thoughts that usually run on in the background. So when we talk about the trauma specific therapy, which is CPT, we're using that same theory, but we're using it just in the trauma setting or that event. So we're looking at the thoughts that were created from a specific traumatic event. So if I was in an abusive relationship, I might tell myself that if I get into another relationship, I'm going to get hurt. And even though my brain is telling me that that is keeping me safe and it's what I should do, it's obviously not healthy to then distance myself from everyone I know and not get into another relationship. Like those are things that we need in our lives to be happy. We find and target those thoughts that got created from that traumatic event. And then by mapping them out, we can start to reframe them and restructure them to be healthier alternatives.
Grace, do you see, I don't know if a trend is the right way to say this, but like, are there certain traumatic events that firefighters bring up regularly? Like they're triggered by the same type of event?
Absolutely. So it's weird. Everyone always thinks that they're the only ones, and they go into the trauma groups and they're like, "Oh my gosh, that's the same stuff I had on the board yesterday." So we tend to see a lot of pediatric calls. That's a huge one. You'd be surprised. I would say more times than not, it's not even the call that's traumatizing them. The call's re-traumatizing them. So the amount of childhood trauma that we see is astronomical. And usually, so there's this thing called complex trauma. So if someone was abused in their childhood and now they're running on pediatric calls where there's child abuse and things in the home, they're not necessarily traumatized by that call. They're traumatized by their childhood. So it can be really, really confusing. And we block out that because, I mean, everyone's childhood is normal, right? You don't know how other kids are living. So you're assuming that everyone's going through that same stuff. But the emotional abuse, the mental, the physical, all those things end up trickling into their trauma now.
That makes sense. I mean, yeah. And that's why I think, these kind of things help because sometimes it brings up stuff that you didn't even realize you were traumatized by.
Yeah, that happens more times than not, honestly. I was surprised when I became a therapist. I was like, I feel like none of this is even call related, right? Like, it's all just going back to their childhoods.
Yeah.
We also have military.
Sorry, say that again.
We also have a lot of military trauma because a lot of the guys that are firefighters were also military based. So we do get a lot of that as well.
But it makes sense because I've had conversations with firefighters. I will say everybody's been very positive as far as getting the word out when it comes to mental health. There are some though who, they may say something, like, oh, well, I was never bothered by that. I was never bothered by that. And, we all handle things differently. But that makes sense, Grace, because if they don't have the backstory that someone else has, they may not be bothered by it.
Yeah, absolutely. And the thing is, too, is we tend to kind of bottle things up. We use the analogy of the bucket. So constantly throughout our lives, we're just throwing things in the bucket. And yeah, we can handle it up until the top of the bucket, but then suddenly stuff starts spilling over. And it's like, oh, well, why all of a sudden am I, struggling when I wasn't before? And in reality, we've just been suppressing all of this stuff until it overflowed.
How does the IAFF address like addiction and substance use and disorder amongst like the firefighters?
Yeah, so the thing with mental health and substance abuse facilities that I've seen across the board in the country is that a lot of facilities focus only on substance abuse. And honestly, I would say that it's really not any different than anything mental health, which is kind of a weird take that I don't think a lot of people would understand. It's kind of, so you can have behavioral addictions too. We see a lot of gambling, we see a lot of sex disorders, we see, or sex addictions, we see all these addictions, but people tend to only look at the substances. So there's really not a huge difference. I mean, addiction is addiction is addiction. It's still hitting that same dopamine center in the brain. It doesn't matter if it's sex or gambling or shopping or video games or drugs or alcohol. Yeah.
You mentioned the group therapy. Are more first responders and veterans inclined to do the group therapy, or do most of them like to do sessions privately?
So it depends, especially when people are first getting there. Because I mean, especially like they could be coming from the other side of the country. So when they're coming there, there's a lot of fear involved. It's a lot of hesitancy, a lot of difficulty being vulnerable. I mean, we're also talking about firefighters who tend to suppress those things. So coming to a facility and saying, hey, pour your heart out is never easy. So usually there's a little bit of a delay in the beginning. The first week or two, you can tell people are like, oh no, I only want to do individual, or I don't want to share with the group. And they just kind of sit in there. And you'll see that they start to open up because they're thinking that they're the only ones with this. And then two people down from them, there's someone with the same exact story. And then suddenly it's, oh, me too, you know? And a lot of things open up from there.
Can you tell me a little bit more of like what happens when a firefighter reaches out for help? Like what's the process? He makes a phone call and then where do you go from there?
Yeah, so we have our admissions phone number. I believe it should be on the website. That would be crazy if it wasn't. The admissions phone number, you call them and they pretty much handle the whole thing from there. And then you would fly in. And do you want to know the like admission process as well? Or, okay. So I'm not on the admissions side. The admissions people are at the Florida base. Most of our facilities are actually in Florida.
Okay.
So the admissions people aren't necessarily at the facility, but once they get to the facility, they'll either have an Uber Health that takes them to the facility, or one of our employees goes out and picks them up, brings them back to the facility, and then they'll do probably about an hour and a half admission process where you're going through everything, asking all those initial questions, seeing what's wrong, what's going on. They do the two things that scare people. So that, I mean, obviously we need to make sure that we keep a safe facility. So that's the biggest, not complaint, but fear when people first get there is like, what's going to happen? Am I going to get stripped down? Am I going to get, it's not a lockdown facility in any way, but they do make sure that you don't bring anything in. And from there, you do a couple of assessments. So you'll meet with the medical staff twice, and then you'll meet with the clinical staff just to get a good foundation for what we're working with. It's all, I mean, it's just your history, so nothing new. And then from there, you'll jump right into it. So you'll do the group therapy 5 hours a day, and then you'll do individuals and everything from there.
Usually is a stone.
So it's about 30 to 45 days on average. It's typically closer to that 35, 45 day mark. There's not necessarily any sort of day. We give them a treatment plan when they first come in. So there's a bunch of objectives on there and they know kind of the game plan for treatment. So once we get through those objectives and we feel like it's safe to go home, then they get their discharge date.
Grace, what would you say is the benefit of seeking treatment at an IAFF facility versus somewhere else?
So I've actually seen a lot of patients where they've been to another facility before coming to us because they wanted to stay closer to home or whatever the case was. And I've seen the general opinion is that they don't get it. When you're around people who have that same lifestyle, who've been on those calls, who are essentially your family, even if it's across the country, the work that we do in group therapy is incredible. Amount that we can open up and actually share and be vulnerable, because when you share with even a therapist who doesn't have that background, there's kind of a fear of, oh, what if I tell them too much? Or what if I bother them? Or what if they don't need to hear this? So going into a space where they know all this, they actually get the chance to share and be completely open. So that's huge.
How do they incorporate like family involvement, or do they, in the treatment?
Yeah, so we do once a week for 30 minutes. They meet with the family therapist, and then if they want to do a family member or a friend or even coworkers, if they want to have one of them, then they do telehealth. So obviously we can't, be everywhere in the country. So they do a telehealth session. The main objective of the session is to help that patient the best we can. So when they reintegrate, typically it's a very confusing process. So it's like they've been gone for 35 to 45 days and they're coming back essentially a totally new person. So we try to bridge that gap so that somebody on the outside sees the progress that they're making, and sets up whatever they need to set up before going home. So if there's boundaries or accountability or anything else in that realm, just having a good support system that knows what's going on.
I believe you said, I could be wrong, but I believe you said in the beginning that you don't do the family.
No, so I've sat in on some of them, but I don't personally do the family sessions.
Just having sat in on some of them, or you're speaking to some of your colleagues, I'm curious because we put a lot of emphasis on the spouses of first responders and how we can all be better.
Mm-hmm.
Are they surprised by some of the things that their significant others do share during these sessions?
So, I mean, it varies person to person as far as like the spouse being surprised by what the patient sharing. So, I'm trying to think. I wouldn't necessarily say that they're surprised. I'd say some patients lean into the vulnerability a lot more and they will completely open up. Some people kind of struggle still with the fact that, yes, I feel safe in this environment, but back home, is this going to be the
Right.
same thing? So it takes a lot of push and pull and testing the waters to see if it's something that they can do. But generally we see a lot of a shift, or a big shift in the relationship dynamic, because now we can talk about emotions, and we can talk about our day-to-day lives more than just I'm good or I'm fine. So yeah, I would say for sure.
What do you think are some of the like biggest misconceptions or fears that firefighters have for seeking mental health help or addiction?
So there's a couple different things. I would say one, it's a fear of the self, right? So I don't want to be viewed in a different way. I want to maintain the strong personality or the strong person that I am right now, and vulnerability is going to make me not this strong person. I'd say there's also a fear of work being a factor, retaliating in any way, which in a lot of cases, there's a lot of different departments that are very, very open and progressive and helping in mental health. There are some that aren't, unfortunately, but I would say that's a big fear. I'd say those are probably the two biggest ones.
When you're working with patients, do you right away let them know that you have the background, like you were raised by a
Mm-hmm.
firefighter? And what is there? I mean, there has to be like even a physical response to hearing.
Mm-hmm. Yeah, absolutely. Usually I dive right in and let them know, because I mean, especially being a little bit younger and I'm newer to the field, so I've been a therapist for a year now. Being newer to the field, I know that most likely they're going to be like, "Oh, well, who's this?" So, being able to say that I have grown up with a dad who's a firefighter and I have a specialized education with the population, definitely you can see the kind of the shoulders relax, like, "Oh, okay, we're good." And letting them know that I do know the population probably way too much, which usually gets a couple laughs.
They probably feel so much more comfortable to truly be themselves. So use the dark,
Mhm.
to slip an F bomb every once in a while if
Oh,
it's
yeah. Absolutely. I think it definitely eases the tension.
yeah, very cool.
So let's say a firefighter or family member is listening right now. What steps would you tell them to take if they needed to seek help?
Well, it depends. So there's a bunch of different levels of care, and sometimes all we need is therapy. Sometimes we need to go that extra mile and do the inpatient therapy. But I mean, definitely call and do the admission process. You can also, one thing that's a little bit more preventative would be having a union member go out there. I mean, if anyone, any union members are watching this, definitely schedule a tour with the facility, because then you can actually see what's going on there and then bring that back to your department, which I've seen a bunch. But as far as any advice to go there, I mean, it's scary. It's a kind of commitment. But in the long run, when we're talking about 35 to 45 days, that's a month for the rest of your life to have, peace and contentment and be able to live with your family. And I don't want, I almost said back to normal, but be better than what you were.
Yeah, I think that's a better way to put it. How satisfying is it for you when you see the patients being better than they were before, turning that corner?
It's huge. A lot of patients, when they first get there, they're like, "How do you do this?" Day in and day out, you're seeing all these people come in and they're, miserable and they have all these things going on and all this trauma, and they forget about the fact that I also see them get to the end and ring the bell at graduation, and they're talking about all these plans they have, and sometimes they send letters back and let us know how much their lives have changed, and it's definitely uplifting. I feel like I'm making a difference every day. Sure, there are people that hate therapy and they want to go back home, but the vast majority of people graduate and they're so much happier. The patients have like this light when they get ready to graduate. You can totally see a spark that they didn't have when they first got there. It's incredible.
Awesome. How do you think the IAFF is working towards breaking down that stigma in the fire service?
So that's a big question. I know a lot of different departments are creating like funds specifically for the mental health field. So if you needed to go to therapy or inpatient therapy, that stuff would be provided. So it kind of releases the friction when we're trying to get help so we don't have to fight so much. But as far as reducing the stigma, I mean, the more people that come to the facility, the more people that go home, and suddenly everyone from that department is coming because they're like, oh my gosh, this is normal. I can do this. I think there's so many parts to the stigma. And the first thing is just being able to say it out loud, right?
I just think it's wild, Carolyn. Did you know that places like this existed before we started doing this?
I had no idea. At least as a spouse, I didn't. I'm sure Alex probably knew about it, but I had no idea. We went to one of the conferences that they had at Miami-Dade Fire Rescue, and there was a young lady there representing the IAF. And she showed us a little bit of like what the facilities look like, how they look like you're in the fire station. And I thought that was awesome. They had the whole like round table for dinner. And I was like, this is what they need. They need something like home, because it is scary to be away from your family for 30, 40 days. No one wants to do that. But like you said, at the end, it's like it's 30, 40 days or the rest of your life.
Yeah, absolutely.
It just blows my mind that, Alex may have known. I don't even know. Jason's not home, or I would ask him. If he knows. I don't know if I'm sure my dad knows because he was with the union at one point. But I think if more of the spouses knew, that would be huge too, because again, we know now, right? We are the first line of defense as far as noticing things. And so it's not just, okay, and in a moment, you need help, right? I can so see that happening to any of us. Like, you need to go, blah, blah, blah. But you would have a direction now. Like, I just feel like now there's a direction. And I hope somebody's watching this.
Yeah.
Not that I want anybody to be struggling, but that someone's watching this, right? And like they can say, this is where you need to call. Go see Grace, right? Like,
absolutely. Yeah, it can definitely be a really hard conversation to have. And it's something that the patient definitely needs to be ready for, right? Like we can't just push them into it. So offering support. And I know when you're in a family unit like that and you have someone struggling that much, it can be really difficult, really frustrating, and hard to really bring down that frustration when you're trying to have a conversation like go get treatment. In that situation, just having that support and being able to kind of gently guide them to that. But yeah, the direction is amazing. And it was only, I think our facility is 8 years old now or so. So it's a new concept. Yeah.
do you know how many there are across the country?
So our facility, any facility that's an inpatient facility for firefighters, there's one.
Okay.
Just that one.
Okay. And how many, I don't want to say beds does it hold, but like how many people can be there at one time?
So 64 patients is max.
Wow.
Wow.
Okay.
Yeah.
Is it booked most of the time?
So right now we have 63 patients, so it's typically up there. We see some dips down, probably into the 40s, but it usually hovers between 40 and 60.
I mean, I don't like that many firefighters or veterans are seeking, or firefighters, I guess, specifically are seeking treatment, but it's nice to know that it's being used, that people are realizing that it's there.
For sure, yeah. I mean, yeah, it's kind of that unfortunate, like, we definitely don't want it, but it's awesome.
But it's nice that it's there. Well, we really appreciate you coming on and sharing, what you guys offer. Again, if there's any family members listening, spouses or firefighters, this is something that is there. Please use it. It's worth it. Like you said, 40 days or the rest of your life, you can have some peace of mind.
Yep.
What's the official name, Grace, of the facility so that we know?
It is the IAFF Center of Excellence.
Center of Excellence. Okay, IAFF Center of Excellence. No, there's no questions. Grace, thank you so much. Grace Seide, a daughter of a Hialeah firefighter, and now paving your own way and making a huge difference as well as your dad. Thank you so much for being here. On First Alarm, we always remind everybody if they see something to make sure they sound the alarm.
Save a life.
Thanks, Grace.
Thanks.